thing that in our clinic we offer different modalities and sometimes things which are not very frequently used in traditional medicine, but we're trying to do whatever is the best for our patients. And in medicine, there are very straight traditional Western approaches, and there are approaches which make common sense, but they're not very popularized among patients. So one of those approaches is energy kinesiology, and now it's time for Steve Hansen to tell us briefly what is energy kinesiology is all about.
Energy kinesiology is, I compare it to computer programming but for the body. So where the body is actually a system of intelligences, and energy kinesiology allows me to use that intelligence to both find out what is stressing the body, meaning what the body's having a hard time with, and then removing that stress, basically allowing the body to be more healthy and remove stress and blockages to health. And energy kinesiology does that through a combination of acupressure, subtle energy, and other approaches within the kinesiology umbrella.
So from my standpoint and from my experience working with Steve, so energy kinesiology has two aspects. One aspect is the diagnostic one, and the second one is a therapeutic one. And so I would like you to explain how the diagnostic portion works.
Mm-hmm. The diagnostic portion of energy kinesiology, like I say, is about finding stress in the body, but it measures a stress response in the body. It measures, it can talk to each individual person. So instead of having just a general blanket protocol for everyone, I can find out what is stressing each person. In other words, what is the priority for each person to get to have their situation improve?
So is it fair to compare, for example, what you're doing with the principle of lie detector?
Actually, it's a very similar approach. Typically, though, instead of looking for a lie, we're looking for something that is causing problems with the body or the mind. And what that is that's causing problems with the body or the mind then gives us a clue as to where we need to approach it therapeutically.
And what is interesting, we did a couple of correlation between what Steve found during his screening and what the blood work shows, and the correlation is pretty high, which is amazing. So because we don't think about that, but there is a very strong correlation between his findings and what we can confirm through the kind of traditional blood testing. And the second portion obviously is the therapeutic portion. So if you can explain our patients how energy kinesiology can be applied to the therapy of the diseases would be great.
Mm-hmm.
Especially to the therapy of, let's say, autoimmune diseases. Right?
So the therapy that I do is, again, about removing stress from the body. It's making it so the body is empowered. The body has the ability to fight whatever it is. For instance, an infection, I'm basically increasing the body's ability to deal with whatever the problem is. Instead of decreasing the problem, it's allowing the body to have more of its natural resources intensified and raised. So for an autoimmune condition, for instance, it's typically caused by a pathogen, a virus, a bacteria, a fungus, something like that. And as the original cause, the body really just needs to kill that bacteria or virus in order to have its autoimmune behavior removed. And so what I would do then is help the body to be able to hone in on said pathogen, and then to activate the T cells to be able to then take out the pathogen. Basically, to give the body a chance to take out the real problem.
And another aspect of energy kinesiology is how energy kinesiology interplays with traditional therapy, let's say drug therapy, or supplements or homeopathic remedies. Could you make any comments on that?
Mm-hmm. So each of those is a little bit different. Energy Kinesiology is great with supplements because I can go through each supplement and test how much the body wants it. Because I find a lot of people taking various supplements that their body might want kind of, or it might not want, or might want a lot. And it depends on how much good it's actually doing for their body. So I can test that. And the same thing with homeopathic remedies. And with drugs, the body can frequently enjoy one part of the drug. Basically, it can be helping them, but it can be hurting another part of the body. So I can then test the person's body to see what they would need in support for whatever that they're taking.
So basically what I want to say is that energy kinesiology can significantly improve the outcome of either drug therapy or therapy with natural products. Right?
Exactly, because I can tailor make what the person is getting to what the person really needs and what the body believes that it needs, because the body has its own beliefs. The body really knows what kind of therapy that it needs.
And so what I want to say is that when we're talking about healing, so they're healing at different levels, and there's a healing at a chemical level. That's what we're trying to achieve with drugs and supplements. And there's a healing at energy level, and if we can come up with a kind of synergistic approach, that synergistic approach can benefit our patients more than anything else, right? So the next set of questions which I want to bring up are questions based on practicality. So let's say a person wants to see you during the appointment, right? So what are the expectations from the initial appointment, and what are the expectations from the subsequent appointments? So let's say you see a person for the first time. What do you do during the appointment? Because from my understanding, it takes a couple of times to complete the initial appointment, right? So what does it take? So what do you do exactly?
So in the first appointment, backing up for a second, I find that besides all the bugs that are bothering the body, besides the autoimmune conditions, that beneath all that there's an environment in the body, and the environment of the body, it determines how healthy we are, and that environment is determined by our thoughts, and a lot of those are subconscious thoughts, and how we're reacting to the world around us. And so on the first appointment, I evaluate what's going on in the person's brain, and the person's brain is going to be either in a state of relaxation and health and abundance, or it's going to be more in a place of survival. And a lot of the signals that our brain is doing in survival have been around since the person was born. And so I look at the person's birth experience, and I basically get their brain balanced to a place where it's going to be relaxed, and it's going to have them in a more relaxed place where their body is going to then be relaxed. And when their body is relaxed, then the immune system is able to function with full capacity. And so in that first appointment, I get the brain balanced so that the immune system can then do what it needs to do at a general level. And so in subsequent appointments, we can go through and we can work on whatever the problem is beyond that. And getting the brain and getting the person's life in balance is a primary step for me. And the person generally feels a big difference after the first appointment.
And in general, let's say if you have a person not with super aggressive disease, but let's say medium level of aggressiveness or activeness of diseases. So in general, how many treatments that person needs to get in order to kind of feel better or reach more or less steady state? I know it's not a simple question because different patients present at different levels of their kind of diseases, but from your experience in general, what would you suggest? Because this question comes up all the time. How many sessions do I need to schedule with Steve to feel better? So what is your general recommendation?
That is a great and complex question, but generally it depends on how long their laundry list is. And so it can be somewhat simple depending on what we're working on. The first appointment, like I say, I like to work on the person's brain, get the environment in their body so that it's all ready to heal. After that, we just go down the list. We go down whatever the person is is trying to work on, whether it's, like I say, that they're a primary virus or a bacteria that's bothering a person, or other complaints that are related to those. And each appointment we can go down the list and really just focus on one thing and get that thing resolved, so that the person doesn't have to keep coming back to see me for the same issue, so that we could take care of as much as we can in one session what's really bothering them. So basically it's determined by how long their list is. I mean, some people it's as few as 3 or 4 appointments.